Don't make this costly Medicare mistake. I had a Zoom call the other day with a client who is going to be new to Medicare on May 1st. By the time she got to me, she had already signed up for Medicare Part D through some sort of a service in her suburb. And so she was calling me to help her with the supplement. And I said to her, you know, after we do your supplement, I will help you make sure that you are in the proper drug plan. So we finish up the supplement, we're going through it. I had her a complete drug list, dosage, frequency, name of medication. And when I ran it through my software, what I realized is that she had enrolled in a plan that was 2 to 3 times more expensive than the most cost-effective Part D drug plan. So I said to her, I don't understand when you put in the drugs into a software when that person was helping you, what was your thought in choosing a more expensive plan? And that's when she looked at me and said to me, well, they never asked for my medications. So I'm like, well, that person was doing you a huge disservice, because when you're choosing your medications, part of the reason you want to put your medications into a software is to figure out which drugs are going to be the most cost effective. Which drug plans. The way that this person recommended the plan to her was by saying that it has a very low premium. That is not the thing you look at alone when you're choosing a Part D plan. You want to look at the overall cost. The other thing that kind of follows with this same thought is that if you're looking at a Medicare Advantage plan, in addition to needing to supply the medications to the person who's helping you with enrollment, you also want to give your doctor's names with the doctor's addresses, because what good is it to choose a Medicare Advantage plan if your doctor is not in that network? The doctor then would be a lot more costly to go to, or if you even chose an HMO, you wouldn't be able to continue with that doctor. So the point being here is that when you're doing this, make sure you have all that information handy. Make sure you're working with someone that is asking for that information. Otherwise, they are not really helping you, and it will end up to be more expensive. And by the way, we were able to correct this. It wasn't too late for her to change to the right plan.